The Prime Minister, of course, blaming the Conservatives for the break in the NHS and causing thousands of avoidable deaths. He responded to a major review into the health service that found waiting times have ballooned and buildings are crumbling. This was just among many criticisms. He's outlined a 10-year plan. Keir Starmer has warned the NHS must reform or die. There will be no new money without change. In a moment, we'll speak to Matthew Holbert, a campaigner in this area, with his own tragic story surrounding this. First, Dr. Peter Carter, former General Secretary of the Royal College of Nursing. Afternoon to you, Peter.
Afternoon, Ian.
You're an experienced clinician. You have been for many, many years. Can you remember a time when we didn't talk about a broken NHS?
No, we've talked about it. I mean, I remember the 1979 general election, Margaret Thatcher seeking to get into power, spoke about it, and Jim Callaghan tried to defend it.
Wow.
And we've been...
We're going back over 50 years here, aren't we?
Yeah, absolutely. I've been around a long time, Ian. Listen, there's nothing in this report today that we didn't already know.
Yep.
An NHS under pressure, an NHS having the kinds of problems which you gave that example from the person that had called in about their dad being discharged at 6 p.m. with the wrong medication. We know about the wrong waiting list. What I want to now see is the detail behind what the Prime Minister is saying about what are they going to do. So we know that we've got huge problems. Yeah. And where is the plan? Because you've only got a limited honeymoon period when you can blame the previous regime.
That's true.
There's got to be a time when you've got to take ownership and say, OK, these are the problems. This is how we're going to go about it.
Yeah, I thought I was the only person that spotted that, Peter. That he was listing a lot of stuff that, frankly, I say this respectfully to the Prime Minister, I could have written that list. You could have written that list. And I was thinking, well, and the solutions are, and, OK, they've promised a plan will come out before Christmas, a 10-year plan, so there will be some meat on the bones. I would have thought a bit of a taster might have, against the backdrop of some fairly controversial words, accusing governments of, essentially neglect to the point that people died and suggesting that this is a broken system that won't be fixed with more taxpayers' money. These are fairly controversial things for a Prime Minister to say. I would have thought it would have come with at least some detail.
Yeah, absolutely. And I mean, the problem is that I remember almost exactly the same speech by Tony Blair, who said, we're going to reform, we're going to put more money in, but with that comes change. Now, the Labour government did do some very impressive things, particularly in relation to waiting lists. But one of the things that they missed was the opportunity to do something about health promotion and the prevention of illness. And Ian, as you know, we now sadly have the most obese children in Western Europe, with record levels of type 2 diabetes. The Prime Minister said that he was shocked to find out when he went to Alderhay Hospital that the primary reason for children under 10 being admitted to hospital in the UK is to have rotting teeth removed from their gums. He said he was shocked. Well, I was actually shocked that he didn't know that.
I was shocked. I remember watching a Channel 4 documentary about 15 years ago on this very point.
And so people talk about we need more dentists, and I think we do need more dentists, but what we also need is where are the parenting skills that should be saying to their children 2 minutes every morning, 2 minutes every evening, and you're going to go a long way to prevent this. So we've got to get upstream. Both the Labour government, just before they left in 2010, had been reducing health visitors and school nurses, and sadly that gained momentum under the Cameron government, and we lost a huge amount of those people. And one of the things I would be saying is redirect some of your resources, get dental assistants, get school nurses into schools, get health visitors up there, get invested in that, and you're going to go a long way to preventing the ill health that we see in so many of our children.
Indeed. And I know that Blair had the kind of independent sector treatment centres, which was a sort of private NHS combination that did, as you rightly identified, that did reduce waiting lists in lots of areas, certainly for knee surgery, that kind of stuff, etc. So it did what it was meant to do. That in itself is controversial, certainly for many politicians. How do you feel as a clinician? Are you relaxed about having a hybrid model, although even that's becoming increasingly difficult because lots of stories out there now, people paying private who are put on an impossible waiting list as well?
Well, look, I'm all in favour of using every resource available in order to get people into treatment as quickly as possible. And I don't have an ideological problem with using the independent sector, providing that, you know, the price is reasonable and that the taxpayer isn't getting ripped off.
Yeah.
But more importantly, what I would be doing, and I know it's difficult, but we have underinvested in diagnostics. I mean, if you and I had this interview in France this afternoon, you go to a GP in France and you've got a lump that you're very worried about, or there's something else, a GP can refer you direct to get a scan, and it's often the next day. In the UK, that doesn't happen. Now, the trouble is, because we're broke, they say they haven't got the money to do that. I would actually invest more in diagnostics, scanners, so that people can get the diagnosis earlier and hopefully get the treatment earlier, which in the long term would be more cost
Indeed.
effective.
I mean, the idea that I didn't even quite realise the enormity of the fact we're short of scanners, and that, you know, per capita, we fare so badly compared to, you know, other countries from Australia to Austria who are doing far better than us. And a couple of years ago, I had a thyroid procedure, and I ended up, it was a hybrid of private and NHS treatment, as it turned out. But the private bit where I had the scan, Peter, I saw the consultant and I said, what about the scan? When will that happen? And she said, walk down the corridor and you can have the scan. Now, OK, I was paying for it, but she did point out that there are many countries around the world that is their default health system that would do that. You would walk out of a corridor, down a corridor and have a scan. So although that was private, it does happen in other similar-sized economies to ours where that part of the treatment process is clearly much swifter.
Yeah, but even countries, I say even countries like Poland, Slovenia, they have more scans per head of population than we do.
Yeah.
I mean, you know, I'm a great fan of the NHS. No one is a greater fan than I am, but we've got to accept there has been poor decisions over many, many decades, and the lack of investment in early diagnostics is a root cause to so many of the problems.
Yeah.
We have some of the worst outcomes for cancer than comparable countries.
Because for that very reason.
Yeah. So what we want to see from the government, and we want the government to succeed, we want to get the health service working properly, but we want to now see the detail.
Yeah. Fair point. Peter, thank you for your time. Really appreciate that thorough stuff from Dr. Peter Carter, former General Secretary at the Royal College of Nursing, now an independent healthcare consultant.